Okay, hello everyone, good evening, and welcome to this series. Is my screen is visible? Now it is visible. Is it clear? And voice is clear. There is no resound or nothing. Everything is fine, right? Thank you. Thank you. So a small announcement before we are entering into the carbo wedge. Already 40 doctors have been registered for Kali Salts and its comparison. Very limited seats are available with very less price. Please look after it. Very limited seats, and we already started discussion about lot of remedies, the case approach, Burnett approach, clinical tips, and some other important remedies. So here my intention is not to be taught about the Kali salts, but in our group we are daily discussing about lot of cases. Burnett's approach we have discussed, the organopathic approach we have discussed, some important remedies with clinical tips. Please do join us. We are sharing and collecting a lot of information just because of you all to promote homeopathy in a classical manner. So what are we are going to learn in this session of Kali Salsis? One is outline of their constitutional appearances. By looking at the patient, how we can describe his Kali Kab, Kali Salf, or Kali Moor, or Kali Bai, or Kali Brome. The clinical usage and comparison of the remedies. Materia medica of a particular drug from almost all important books like Farrington, E.B. Nash, Margery Blackie, Wheeler, Phobister. There are a lot of other remedies we are collecting from Borland experiences, elements of homeopathy, different books we are referring and making you to understand exactly picture what it is. And group study as well, very useful for UG students in exam point of view. Stalwarts experience and their remedies with case discussion, understanding the genius of the remedy with lot of delusion rubrics. Just with one delusion rubric, we can understand the whole gist of the remedy that we are bringing up in our Kali salts. That experience you will understand, and it is easy way of prescription. In this, in the carbo which you will understand what is that exactly, and how mind rubrics were compared with other remedies, and the confirmatory symptoms of each remedy. Like if a patient of Kalikap, what we should ask for a patient to confirm Kalikap or Kalibrom, Kalibai, Kalisulf, Kalpikricum, etc. So this is we are coming in front of you. And how to find remedies in clinic. Recordings will be available. 6 months of access we will be giving for recordings, and fees is very minimal, just 350 rupees. And we are discussing about 15 remedies, 15 to 16 remedies. So each remedy costs just 20 rupees. So please do join us. This will be an eye-opening session for you all. Thank you. So good evening all. Welcome to our series Carbo Veg, the understanding of deeper patterns of different approach of carbo veg. Today we are going to learn the deeper patterns and the different approach of carbo veg, how we can use carbo veg in each and every angle. Carbo veg is not for collapse, carbo veg is not for flatulence. How this flatulence has occurred, why this carbo veg is in a collapse condition, what could be the background of this, that we need to understand. Once if you understand the background of that, the remedy will be remembered very easily and can be applied clinically very well. Is it clear? Is it going well? So someone has where we can join. This that session is in Zoom session. We will be providing you the link. And if you are not in our WhatsApp group, we will at last there will be our WhatsApp group link. You can join there. Details, everything will be forwarded in WhatsApp. Right. So coming to today's remedy, carbo veg. So before understanding carbo veg remedy, try to understand what is carbon first. Carbon is an inert substances, and the remedy carbo which put in our mind the idea of inertia or sluggishness. Its symptoms are characterized by lot of sluggishness you can see in this remedy. When an inert substances combining can produce the pathology of sluggishness, that is the main core of carbovage. Carbon is an inert substance, is an inert material. So this sluggishness is not only seen at the physical level or at the pathological level, this sluggishness can be seen at the mind level. When the mind, the psychosomatic dynamics is sluggishness, that will be reflecting on the pathological level, or that could be reflecting in the physical level. That we are going to learn today. So the sluggishness is everywhere, either in the reaction, recuperation, the circulation, or the digestion, etc. So let us first consider the sluggish reaction or the resistance. What is the sluggish reaction? So the sluggish circulation produces its own complications such as varicose veins, varicose or non-healing ulcers, edema of dependent parts, icy coldness of various parts such as hands, legs, knees, nose, tongue, etc. Even the breath may become cold, and the physician may feel a cold fear clutching at his heart when facing a carbo wedge, such as amoebae erectations, amoebae fanning, etc. Then this remedy will be positively useful. So try to understand this line. This line tells you the exact carbo wedge picture in your clinic. Patient comes to you with lot of sluggishness, lot of weakness, in a state of collapse or in a state of disoriented oxidization, very weak, lean, about to collapse, and you just go and examine the patient, touch his hands, it is very icy coldness, touch his legs, icy coldness, knees coldness, nose coldness, tongue, even the way patient talks, tell about your complaints, the breath becomes so cold. That is the key confirmatory of carbovage. That sluggishness you can see in carbovage. And here he discussed about varicose veins, varicose, non-healing ulcers, edema. When the circulation is so sluggish, they develop the pathology of varicose veins, non-healing ulcers. So why this sluggishness is due to disintegration and imperfect oxidization is a key note of carbovage. Is it clear? Is everything is clear? Shall I proceed further? Yes, yes, thank you. So, one of the finest indications of carbovage is when patient comes and reports that he has never been well since an attack of some infectious disease. Remember this term. This is very, very important in almost all cases where we have failed to prescribe the right remedy. Whenever a patient comes with so and so XYZ pathology and says, doctor, I am never well since this COVID time. Now, after COVID, my body is not the same as before. He is giving an indication that some infectious disease has been attacked. From there, his body is becoming sluggish, or his body is not responding well as before, or his body is not responding the same active state like before. There you go into the rubric called never been well since. Almost all diseases. Tell me the remedy. Never been well since burns. What is the remedy? Never been well since after burns. What is the remedy? Some doctor says that Cantharis, it's causticum. Causticum never well been since burns is causticum. Tell me the remedy. Never been well since pneumonia. After pneumonia, everything has started. What is the remedy? Do text in the chat box. This is just a discussion, so we can elaborate everything. Kalikab. Nice, right answer. Never been well since typhoid. What is the remedy? Okay, China. Never been well since after typhoid, then patient develops lot of hair fall. What is the remedy? No, it's fluoric acid, not phosphoric acid. Fluoric acid is the remedy. After typhoid, the patient develop hair fall. That is fluoric acid. And interestingly, now we have got about hair fall. I'll tell you one of the two important remedies which we can help the patient very well is one is thallium met. If you open boric metromedica, thallium met, after infectious disease, they develop hair fall. Thallium met do wonders. The other remedy you can think of is Mancinella. Mancinella, open boric right now. If you have anybody, Mancinella head last line, he returns. Hair fall after acute illness. Mancinella, one of the remedy. The other one I said thallium met. The other one is fluoric acid. There are many more, but these are the top remedies you can prescribe. So here what I am concentrating is that the genius, that is the genius, never been well sings. Now, someone will ask, okay, doctor, now you are saying very good, never been well sings so and so disease, but how we can search in repertory? If you are using synthesis repertory, go into generals, convalescence, elements after. That is the rubric you can take. In complete repertory, there will be directly elements after pneumonia or elements after typhoid, elements after so and so. So elements from is the most important thing. So here, these remedies comes into rescue pattern. I feel that all the remedies which were mentioned in never been well things are the rescue remedies. Because whenever you have prescribed a constitutional medicine, but that constitutional medicine is not covering this never been will things, but the patient is fine for few months, but again the recurrence has started, again the recurrence is started for 1 month or 2 months or 3 months. Now you are missing the core. When this is started, the never been well things, this will help. The carbovage will help, because carbovage is acting on all the body parts, not only the particular symptom or particular body part. So that's why carbovage will make the patient to have some reaction. If the patient get that reaction, then patient will open up what exactly he is going through or she is going through. Sometimes many eminent homeopaths have said carbovage will open up your case taking, because it will provide you the slightest reaction to the patient, like sulfur. Is it clear? Is my voice is audible? Yes, yes. Thank you. Thank you. So next line. Almost specific for asthma, never been well since after asthma, originating from the attack of measles or whooping cough. Never been well since after whooping cough. Drosera you can think of. Other remedy pertussin. Pertussin. That is also one of the remedy we can think of in whooping cough, along with carbovage. So one of my teacher used to repeatedly state that the expression of patient is never been will saying should put always carbovage in one's mind, whether it is after an attack or pleurisy or any acute infection or even an injury. This line you keep in mind. Whenever a patient says never well being sings, immediately go for carbovage, give intercurrent carbovage along with your constitutional medicine. Just one dose of carbovage. Just one dose of carbovage. That will eradicate the layer of sora, the miasm of sora. He has treated numerous cases successfully with carbovage on this indication, even when the existing symptomology of patient is not characterized by the symptom of carbovage. Understand this line. This is the beauty. This is the genius of carbovage. So my intention in this webinar is to cover carbovage in a different pattern, understanding the remedies into different pattern, where no one yet to be viewed. You must view that. Is it clear? Yes, thank you. So this is a charcoal form of carbon produced from plant sources, which brings us quickly to the topic of carbon oxides. At the moment of birth, our first struggle at the cellular level involves an oxide of carbon, which we must eliminate through the breath. This is collected by one of the beautiful writings by Gardner. He's a beautiful homeopath and his writings will be very beautiful. Understand this para, you will understand what is carbovage or carbon. At the moment of birth, our first struggle at the cellular level involves an oxide of carbon, which we must eliminate through the birth. The child in the utero receives its oxygen through the umbilical cord. When we cut this link, the oxygen supply stops. This is the first step that where every human being must take. We must begin to breathe. If this does not go smoothly, if we turn blue for few moments, or if we have already been acquainted with this form of intoxication during the intrauterine period, when mother smoked too much or lived in a smoking filled environment, then we will be sensitive to this element and will display little or no reaction to other remedies. This is carbon. This is carbon. How beautiful link it is with umbilical cord, with the fetus, or with the uterus. From there itself, we are struggling to have these carbon, the charcoal, the oxygen. Now, the core of these remedy is sluggish reaction, is also a feature of old age, and carboveg is one of the remedies for complaints of old people. Remember this. Sluggish reaction with featuring of old age, carboveg is one of your top remedy. You need to think of this remedy always in your clinic. Now, how this non-homeopathic use of carboveg? So understanding homeopathy is different, right? Before understanding the remedy, you need to understand what is this actually. What is carbon? From where it is extracted? How much degree it is? Where it lives? How it lives? Why it lives? Then you will understand homeopathy well. Then you will understand the remedy picture very clear. The mucous membrane of the stomach and its glands are sluggish, and therefore the production of an acid and pepsin must be poor. So due to the sluggish nature, the production of acid and pepsin must be poor in the digestion. So this leads to sluggish digestion, which creates a feeling of heaviness in the stomach. So coal is used for producing coal gas. It is often used in a crude state by allopathic doctors by observing the gases in GI tract. So charcoal is said to absorb 40 times of its volume of the gas. Now you understand why carboveg is one of the top indication for flatulence or abdomen distension or GI, spear of GI. Sorry. It was also used as a deodorant and is applied to putrefying ulcers. Understand this line. In old school homeopaths or old allopathic doctors used this as deodorant and applied for putrefying ulcers. But instead of using this crude carbon to absorb the gas that is produced and to remove offensiveness, we utilize potentized carbon to prevent the formation of gas and to prevent putrefaction. The offensiveness you can read in the crude form. There is such flatulence that the patient feels bloated all the time, though this is relieved by belching. The erectations relieve the patient as a whole. Probably the inactive stomach and sluggish digestion allows organic fermentation, leading to the formation of the gas. Now you understand why carboveg flatulence. This is the cause. The sluggish digestion, where the production of acid pepsin is very poor, and the charcoal absorbs 40 amount of volume of the gases. How now you want the link between this non-homeopathic point of view and use of homeopathic point of view is this. You can understand the intensified symptom, even flatulence for China, flatulence for lycopodium, flatulence for carboveg. But see the intensity of carboveg flatulence that you learn through non-homeopathic point of view. Is it clear? Is it going well? Thank you. Thank you. So, what is the core of carboveg? Very pale face. This I will tell you why carboveg has this pale face, how to identify. Weak vital force due to sluggishness. And it is a savory of life and flatulence. These four will give you the core of carboveg. Now, why carboveg is called as a savory of life or corpus reviver according to E.B. Nash. So, if someone, a budding homeopath, ask me what Materia Medica to be read, I first prefer to ask them to read Nash Materia Medica, Leaders of Therapeutics by E.V. Nash. That is one of the beautiful book you must have. You must read it. Then only you can start reading other Mathematical books. Nash is always your first book to begin with. E.V. Nash. Beautiful book, and it was written very well with lot of comparison. So during the terrible epidemic of typhoid fever a few years ago, I was called to a consult in 4 cases. This is Nash case. One of the worst was as follows. After I had seen 38 cases with the physician who called me, we were walking on the street and met a man who shook hands with doctor, introduced me to him, and inquired of him about the other case. He answered, there is no hope. 2 physicians have just left her to die. Even I then told him that I was there to console him. Well, said the man, my brother is poor, but if your doctor will see here, I will pay the bill. She was certainly in an apparent hopeless condition. She had no movement of bowels for 14 days, notwithstanding old school cataract in abundance, and they had informed the family that bowels are very paralyzed and could never move again. The abdomen was enormously distended. She laid upon her back with her knees propped up. She was cold, pulse is flickering and weak, hypocritic face, and they were fanning her to try to give her breath. There was no restless like arsenic. Another homeopathic remedy used for similar symptoms, and she was past that. In answer to the doctor, look, I said there was but one small chance left. I felt it. We dissolved some pellets of CARBO 200 in water with directions to give a teaspoonful once in 2 hours. So interesting here. I do the same. So in someone asks how to give dosage and potency, right? In almost all emergency cases, try to repeat in teaspoonful dosage. 5 minutes, 10 minutes, 15 minutes, 1 hour, half an hour, 2 hours, immediately. Like 4 doses for 5 minutes, 10 doses for 5 minutes, 10 into 4, 15 into 4, like that. That will give up. And after in the morning, she was alive in the morning and better. And under the remedy, the balls moved naturally in the couple of days, and that gives you a rapid relief. Carboveg was followed by China 200. This is the importance of Carboveg. And interestingly, Nash has mentioned that arsenic. Arsenic comes very, 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 very close to Carboveg in this scenario of cold breath, sluggishness, whatever the symptoms has, this paralyzed, weakness, hippocratic face, fanning want of, pulse is very flickering and weak. Very, very close to arsenic. But the major difference is restlessness. In Carboveg, there is no restlessness because of sluggish circulation. There is no circulation at all. The body is very weak. How a patient become restless? But if he is in such a state, having very restless, immediately give arsenic before choosing Carboveg. This is the beauty of Nash. Now, interestingly, Carboveg versus arsenic alum. Coal, which is itself the product of combustion, and coal gas are used for burning as fuel. So Carboveg has burning with external coldness. Try to concentrate on this line. Patient says, doctor, I'm having lot of burning, but internally I feel lot of coldness. Is Carboveg. Burning with external coldness. That is Carboveg. Lot of burning, but externally the patient is lot of cold. And the burning may be relieved by heat, as in like alumina, like arsenicum, like capsicum, like lycopodium. These 4 remedies come very close here. Burning relieved by heat. When this coldness is associated with the condition of collapse, then we definitely consider Carboveg. Now, interesting point is, Carboveg is a good remedy for collapse as arsenic, but the collapse picture of one is very different from the other. That is, the Carboveg condition may come on gradually, but arsenic is characterized by lot of suddenness. This is the difference. This you need to understand. How patient expresses this. Doctor, he is very well, like he so much was very well before 1 hour or 2 hours now, but he is weak, but he is so well before 1 hour. Slowly, after 1 hour or 2 hours, then patient went into sudden collapse. Arsenic patient, very slow. Arsenic patient, sudden collapse. Within few seconds, the patient went into collapse state. That is arsenic. The suddenness you can see in arsenic, but the sluggishness you can see in Carboveg. The slow-paced carbon is CARBO-VEG. Arsenic is more of fast-phased remedy. Secondly, the CARBO-VEG patient may go on to collapse and may pass away quietly, while arsenic patient, even in the extreme stage of collapse, is restless and wants to sip water by thirst. There is a lot of thirst you can see in arsenic, along with the extreme stage of collapse of restlessness. The CARBO-VEG has no anxiety at all, whereas arsenic is full of agony, anxiety. From this anxiety, they go into the state of restlessness. With that anxiety, they have a lot of thirst. Sip by sip thirst. Is it clear? This picture is clear. Please do text in the chat box very soon. Is this picture is clear? Is everything is going fine? Thank you. Now, CARBO-VEG versus Kali carb. Interesting. This is very, very interesting. If you open any CARBO-VEG remedy and read the complementary remedy, Kali carb is a complementary remedy for CARBO-VEG. But we know generally that's all. Okay, CARBO-VEG complementary is Kali carb. But why this Kali carb is complementary to CARBO-VEG? Is here. This is what I want to teach you. This is what I want to express you or tell you that what has exactly happened before the scenario, why they have kept Kali carb as a complementary, what could be the reason. In my next coming sessions of paid or free, I'm concentrating on this. We need to know why and what. This material we have collected from lot of books, referring lot of books, reading it line by line, day by day, understanding what it is. From that we are collecting the gist and making you to understand in a very easy manner. CARBO-VEG generally contains small quantities of potassium carbonate, and these may be explain both the complementary relationship and the similarity between these remedy and Kali carb. Interestingly, whenever you have prescribed a patient CARBO-VEG but he is not well, or he is well but again the same relapse has occurred, immediately go for Kali carb. It will cure the case. This is the key. Now, interestingly, both are chilly remedies. Both antidote the ill effects of loss of fluids. Both are flatulent. Both are weak. Both having affection of heart, producing myocardial weakness. But the major difference modality is CARBO-VEG is amyl by fanning, Kali carb is aggravated by it. This is the beauty of clinical methodology. This is what we are coming up with. This is what we want to teach you all. Evolve, understand, apply in your patients. This will give you the results. Now, if a patient is in front of you and you are thinking to give CARBO-VEG or Kali carb, what to think? Just ask this question: Do you want fanning? Ah, no, no, doctor, I don't want fanning. If fanning is there, now I cannot tolerate Kali carb. Fanning, yes, doctor, I want fanning. I will be sitting under the fan itself. CARBO-VEG. This is clinical application. This is clinical Metramedica. This we want to teach you all. Join our session. We'll explore a lot of remedies of Kali salts. It's for you all. We are doing the hard work. So mind unconscious coma with lot of croup is CARBO-VEG. Mind unconscious with coma eating after. Immediately eating after they go into the coma. The remedies are CARBO-VEG, Magnur, Naxomica, and phosphoric acid. Right. So I will give you a gist here. Now many people read the rubric and just go away. But when to give CARBO-VEG, when to give Magnur, when to give Naxomica, when to give phosphoric acid. Now I need immediate text from you all how you can differentiate at least the three remedies: CARBO-VEG, Naxomica, phosphoric acid, or Magnur. What questions you put in front of you if you take this rubric, and how you confirm with the patient. Chalo, do it fast. Do it fast, please. Let's interact here. Okay, irritability for Naxomica. Nice. So what are the remedies? How you differentiate? Carbohydrate amide by belching. Okay, fine. Interestingly, Naxomica complaints aggravated after eating. Okay, fine. That is what the rubric there, right? I want to know what question you put in front of the patient to confirm the remedy. That is my major question. So, my dear friends and colleagues and senior doctors and practitioners, this is we are lacking in. We are very much experts in case taking. We are very much experts in Metria Medica. We are very much experts in taking the rubrics and adding that, getting the sheet very perfectly, understanding the patient and pick upping the rubric very perfectly. But interestingly, all four remedies are covering all symptoms with all grades. Then now what to give? That is where we struck, right? Now I will tell you excellent clue or excellent understanding of these. To give phosphoric acid, try to ask them, do you like fruits? Phosphoric acid desires for fruits. I will concentrate on physical generals itself because physical generals are the clue to have anything. And here you see phosphorus and acid group. Ask them, do you want to love, care, affection? Ah, yes, doctor, I want all the love and all the love, care that I need. Phosphorus. But patient says acid. Weak acid. They are very much tired of this. They say, no, no, doctor, I am very much tired now. My mother and father, before they care well, now they are not caring. I am tired of this, all this. Is phosphoric acid. The core, the gist I am asking there. Desire for fruits is phosphoric acid. Weakness is phosphoric acid. Sibling rivalry is phosphoric acid. Unequal struggle of love is phosphoric acid. Fatak single repertory, single rubric, unequal struggle. They always want of juicy things because of weakness, because of acid, cold things like phosphorus. This is just. Now coming to Noxomica. Spicy desires, stimulants desire, very irritability. I generally ask the patient, do you get sweating while eating? Oh yes, doctor, I get lot of sweating, especially on the lips, on the lips I get lot of sweating. Noxomica, key confirmatory of Noxomica. In your school, how you be, or in your college, how you be, how you in your job, how you be. Ah, doctor, in my job now I am so much ambitious, I want to complete this work, I want to show that what I am for. Noxomica, ambitious desire for what I am trying them to understand the core. Who is the person in front of you, and from where the patient is falling under. That is what I am confirming. Spicy desires, Noxomica. Stimulants desire, alcohol desires, Noxomica. Perspiration while eating, Noxomica, especially on the upper lip. Especially on the upper lip, that is Noxomica. Anger, jealous. Coming to Magmure, magnesium is more of peacemakers. They are pacemakers of Medica. With Mure element, they are disappointment of love, sadness, grief. You can see that is Magmure. Is it clear? Is it fine? Did you understand this? Right, some patient has asked, he's unconscious patient, how you will ask, right. Now in unconscious we need to understand the examination pattern. If you understand the examination pattern, as I said, if you touch the extremities or lower extremities or upper extremities, then the patient gives you a lot of coldness, carbovage. Noxomica is more of hot patient. Phosphoric acid, sometimes very good question has if they are unconscious, how to confirm. Sometimes you must confirm with the attendance what actually the person is. Who is this person? That will give the gist of clue, or understand the physical observation. Examine the patient, that will also will give the clue. We have enough points to understand. Mind unconscious, coma, dead as if, like arsenic, carbovage and arnica. Now, carbovage is a remedy for death, and local death leads to decomposition and offensiveness as in gangrene. There is lot of offensiveness with lot of gangrene cases. Is carbovage. Burning and coldness of carboveg. Burning in inflamed parts, internal burning, external coldness. This is the key of carboveg. Never forgot before prescribing this remedy. Before that, I have something right here. See, mind unconscious coma dead off. Now, some patient has asked, they are unconscious. How to examine? Now, I will tell you. Some doctor has asked if patient is unable to say any complaints. It is your fault, my dear doctor. You must take. You must have that art of prescribing, the art of interrogation. We patient will tell you until you put a right question. So here I will tell you the examination pattern. Suppose the two remedies you consider are carboveg and arnica. In the third rubric, if you examine arnica patient, head is so hot and the extremities are cold. Like this, you examine patient coming down, and there is a lot of coldness, but head is hot. That is arnica. This is examination. This is examination. But carboveg, everything is cold. Everything is cold. Every body is cold. That is where you need to differentiate. Arsenic with restlessness, anxiety, thirsty. Is it clear? These pattern you need to understand, not just looking at the rubric or repertory. Try to differentiate why this remedy is in this rubric. What could be the probable cause? Why Kent has given? Why Boningen has given? Why Fatak has given? What background it is? Coldness with feeble circulation, with feeble heart, icy coldness, lot of coldness you can see. Coldness in the stomach and especially the burning as well. Both you can see there. Now, bleeding in carboveg. Bleeding runs all through the remedy. The oozing of blood from inflamed surfaces, black bleeding. Why black bleeding is due to sluggish circulation. Almost it comes very close to almost all snake remedies like Vipera, like Lachesis, like Vespa Carbo, like Crotalus hirudus. Bleeding from the lungs, from the uterus, from the bladder, vomiting of blood, lot of passive hemorrhages you can see in carboveg. On account of the feeble circulation, a capillary oozing which start up and continue. The remedy hardly ever has what may be called an active gushing flow, such as belongs to belladonna is more of active hemorrhages, ipecac, aconite, sickle core. But passive hemorrhages, carboveg is one of the top indication where the flow comes with violence, but it is passive capillary oozing is carboveg. The women suffer from this kind of bleeding, a little blood oozing all the time, so that the menstrual period is prolonged. This you need to understand. Oozing of blood after confinement, that is to be stopped immediately by contractions. But there are no contractions of the blood vessels due to sluggishness or coldness. They are relaxed. So that's why they go into the state of black venous oozing. They go into a gangrene state. They go into ulcer state. After a surgical operation, there is no contraction and retraction of the blood vessels. This is the carboveg bleeding. Role of carboveg in ulcers and gangrene. Now, tell me very few top remedies, top in the sense good indicated remedies for gangrene, ulcers, non-healing gangrene ulcers I am talking about. Chronic gangrene, chronic non-healing ulcers. Remedies first. Sickle cord, graphitis, arsenic, pyrogenum, sickle cord, silicea, pyrogenum, epis. Fine, good. Nitric acid, anthracinum, nice suggestion, anthracinum, lachesis, crotalus. Fine, good. Thank you. Everyone is active. So, in almost all non-healing gangrene or ulcers cases, the remedies you can think of is anthracinum, tarantula cubans. No one has given the answer. Tarantula cubans. Okay. Then carboveg. Then almost all snake remedies will help in almost all ulcers and gangrene cases. And sickle core. If you open Allen's, anthracinum will give you. And there is other remedy called euphorbium with lot of gangrene cases with lot of burning. Even anthracinum has the lot of burning like arsenic state and nitrosamine like mine. That is anthracinum in gangrene and ulcers and inhealing ulcers, indolent ulcers. If you have a case, such as I have described, with relaxation of blood vessels, feebleness of the tissues. You need not to be surprised if there is no repair, no tissue making. So when the part is injured, it will be stuck. If an ulcer is once established, it will not heal. The indolent ulcers can be carboveg. Hence, we have indolent ulcers, bloody, echorious, acrid, tiny discharges from ulcers. The skin ulcerates the mucous membrane, ulcers in the mouth and in the throat. So whenever you have prescribed your favorite remedies or your constitutional remedies in ulcers and gangrene, but not at all helping, give a try with carboveg. It will help because of sluggishness everywhere. Carboveg is relaxed. The indolent ulcers is carboveg. This is the beauty of carboveg. I want to explore carboveg in a very beautiful manner that it is one of the top of top remedies in homeopathy. Ulcers everywhere because of that relaxed and feeble condition. Understand this, everywhere. Poor tissue making or none at all. The blood stagnates in the capillaries. We can see how easy it could be for these feeble parts to develop gangrene. A little inflammation or congestion become black, purple, sluggish easily. That is all that is necessary to make a gangrene. So it is a wonderful remedy in septic conditions, blood poison, especially after surgical operations and after shock. It is a useful remedy in septic conditions, in scarlet fever, in any diseases. This line you understand. In any diseases which takes on a sluggish form with purplish and molted appearance of the skin is carboveg. Someone will say, how you can understand Metra is this is what you must understand, the in between lines what it is written. In any diseases, that means whatever the pathology you are dealing with, XYZ, whatever, but if it is in a sluggish form and the appearance is purplish, immediately give carboveg. This is observational prescription, you need to understand. Theme of carboveg. Carboveg is especially indicated in patients who are advanced in life and subsequently debilitated. It is called for a weak, delicate persons who are old dyspeptics, especially if they have abused their digestive organs by debauchery. After bad effects of alcohol, we always think of Naxomica. Carboveg is one of the remedy. Ambra is one of the remedy. Aluminium is one of the remedy. Here, what it is written, you see, especially if they have abused their digestive organs. The action is on digestive organs. Concentrate on these. Carboveg do wonders. I have many beautiful cases with carboveg, which I will share in my almost all paid sessions. How, why I've given carboveg, what cases I treated with carboveg, either the acute or even in ICU emergency cases of two brain stroke, right sided brain stroke and left sided brain stroke. Very well they did with carboveg, but followed with hydrocyanuric acid in further follow-ups. Now, clinical view of carboveg. Carboveg indicated in hemorrhages from the lungs, not only hemoptysis but also in bronchoria. In these cases, the patient suffers from great anxiety and yet without any particular restlessness. Now you understand here. Carboveg also have the theme of anxiety. Arsenic also have the theme of anxiety, but the restlessness is absent in carboveg. The anxiety is very evident in the face and it affects at breathing, but there is no particular restlessness and tossing about. That is carboveg. It is indicated in hemorrhages from the lungs. Carboveg. I am showing you the broader view, the broader application, the actual carboveg in front of you. The patient complains of burning pain in the chest. Carboveg is used to be used especially in well advanced cases of lung degeneration. Carboveg, my dear. In advanced pathologies, hemorrhages of the lungs, in advanced cases of lung degeneration with lot of burning pain in the chest, carboveg is indicated. The pulse in these cases, intermediate, thready, face is pale and often covered with lot of cold sweat, and patient wants to be fanned because fanning brings more air into the lungs. This is clinical. This is clinical view of carboveg. This is for you all. Carbovage will here work hard in hand with arsenic. Arsenic is useful in this persistent hemorrhages of low type, depending upon some degeneration of the organ affected. Both it and carbovage have this violent burning pains with arsenic. However, you have a distinction which applies in all conditions is irritability, fibry mind is arsenic, which in carbovage it is absent. Carbo, which is torpid, sluggish remedy, while arsenic is irritability, restlessness remedy, and anxiety. This is beauty. This you need to understand. Carbovage may also be used in asthma, particularly in asthma of old people and of people who are very much debilitated, weak. That's why this remedy comes very close to calcarea carb, kali carb, sorry. They look during the asthmatic as if they could die. Very oppression of breath. This is what you can see. This is observation pattern. They are greatly relieved by belching wind. It is especially indicated in asthma, which reflects from accumulation of flatus and abdomen. Now, whatever the pathology, see the asthma pathology connecting with the GI pathology. So the generalities of belching amel, if you find any patient who having this belching amel, which can be indicated when other totality matches. In threatened paralysis of lungs, in typhoid fever, after pneumonia, and in old people, the paralytic catarrh of old people calls for carbovage. They are losing rattling rails like antimonium tartaricum with patient coughs and breathe and marked symptom of emphysema. The bronchial tubes are greatly dilated. In addition to this, you will find lot of coldness, symptoms of collapse, etc. The nearest approach to carbovage in emphysema is ammonium carb. Interesting. And I will tell you one beautiful, beautiful clinical tip. Generalities, obesity with heart complaints. Only remedy ammonium carb. And if patient having this luxurious sedentary habits and they develop lot of respiratory complaints, ammonium carb. Sedentary in old people they are sedentary and lot of obese. The remedies are ammonium carb, cocculus indicus. These two remedies you can think of, and other remedies kali carb, right? Which is like carbovage and has blood poisoned by carbonic acid, giving you coldness, blueness, etc., and indicated in that condition. Is it clear? Is it going well? Chalo, I can think how many are active. Do text in the chat box. Is it clear? I'm getting very little replays. Yes, thank you. Carbovage is an excellent remedy for terrible dyspnea of chronic erotics, especially when the patient has become very anemic and dropsical. Dropsical. Interestingly, we had a discussion in our paid group. I asked about some dropsical conditions with heart complaints. Everyone was giving apocynon, epis, or some. Whenever you find dropsical, it is not of more of apocynon. You need to understand why the patient is in dropsical condition, what the pathology is affected. Apocynon dropsical is more related to kidney pathology. Epis dropsical is related with kidney pathology. Digitalis dropsy is related to heart complaints. Squilla dropsy is related to heart complaints. Carbovich complaints dropsy is related to asthmatic complaints or the body involvement with lot of anemia. In every pathology, we can get the general rubric of dropsical. But you need to link what pathology the patient is suffering with, then add that rubric or understand the pathology with Metromedica. In almost all CKD cases, there will be dropsy, but only three remedies work well: ilserum, apocynon, epis. But three are having major differences. When we can give in CKD cases apocinum, when we can use CKD cases of EPIs, when we can give L-serum in CKD cases, almost all the dropsies are same, but the prescription is based on one particular peculiarity that you need to understand. That is the view we need to read in a remedy. Carbovage may be indicated in dysentery. Tell me the beautiful remedy in dysentery immediately after eating. When your well selected remedy fails to act, do it fast. Allos, okay. When your well selected remedy fails to act in dysentery immediately after eating. Naxomica has failed. Allos also failed. Think out of the box. This is what I want to teach you all. This is what I want to educate you all. As a homeopath, we must not struck because we have a lot of scope of remedies. We need to learn. Sulfur is failed. Colchicum is failed. Ipecac is failed. Mercure is failed. Sedum acre. Sedum acre is more related to piles and hemorrhage, my dear doctor. When nitric acid fails in almost all burning pains with lot of dysentery or piles or hemorrhages, sedum acre works well. Opium fails. Podo fails. Sorinum fails. The remedy is thrombidium. If anyone have boric with you, you can open thrombidium. You thrombidium 30 in water dose, it works very well. In boric, it is written dysentery immediately after eating. When all your top remedies fails to act, it will work for sure. Gunshot prescription, thrombidium. Thank you for your suggestions. There are burning pains situated deep in the abdomen, usually in one or the other of the beds of colon. The abdomen is greatly distended and tympanic. The pulse is weak and intermediate. The discharges from the bowels are horrible, offensive discharges, brown, watery, and slimy appearances. Okay, up to here we have discussed in what conditions CARBO can be given. The clinical point is completed. Now I am coming into the mind section of CARBO. I'll give you gist of some periodic table of CARBO, just a gist so you can understand. See here, CARBO is in row 2. This is row 2. Here it is carbon. Carbon, nitrogen, oxygen, fluorine, neon. Right? Now, row 1, hydrogen, helium. And coming to the column, first column, second column, third column, fourth column is CARBO. So what this indicates is actually in carbon group, they feel, am I separated from my mother? In the first line of para, we said that they cut from the umbilical cord. They are new to the other world. They feel, am I separated? Do who I am? Do I exist in this world? That separated started there itself. The complaints have started there itself. That's why carbon is more reactive element in chemistry. Whatever remedy you take, it will react with them. Almost all our intermediate, we have studied carbon remedies with will be linking with all the remedies in periodic table. Only because they feel I am separated. Now I want some attachment. The warmly attachment I need. That by carbon react to almost all elements in periodic table. This indicates the carbon dependent nature of some on some other else. This you reflect to your Medica. You will understand carbon, carbovage, or carbon remedies their mental state. They want the motherly attachment. They want the care. They want that warmly attachment because they're separated. They don't know how to live, how to exist. They are just separated from the mother's womb of umbilical cord. This is the beauty. That's why the central rubric of CARBO is mind clinging. They always cling to the father or they always cling to the mother. Papa, Papa, don't go, don't go. I will come. Papa, Papa, wherever you go, I'll come. Mother's attachment, father's attachment, the clinging nature you can see in CARBO. Even antiemtot has gelsemium, bell, bismuth, camphor, coprum, kalika, pulse, lycos, and ancla. But the theme is different there. The clinging nature of antiemtot or gelsemium is different. Gelsemium clinging nature is due to anticipatory anxiety. Lot of anticipatory anxiety. From this anticipatory anxiety, they've become dull, drowsy. That's why they cling. Pulsatilla is more of yielding disposition. They want relationships. That's why they are not. They won't go into any fight. Mild, mild ladies, mild women, mild men's pulsatilla due to that clinging nature. These you need to understand. So what carbon tell? How are you in taking decisions? I cannot take decisions, doctor. Very confused state. Because they are just born up like carbon. They are just born up. See in the periodic table, they are at the sixth number. They are just born up. They don't know. They are just separated. They want the dependent nature. This is carbo-rich or carbon. Now anxiety of carbo-rich. In carbo-rich, the sleep is so full of anxiety that it may be said to be awful. On going to sleep, there is anxiety, suffering, jerking, twitching, and yes, horrors. Everything is horrible. You know why? Can anyone tell why these sleep after sleep carbo-rich patient feel lot of anxiety? Okay, some doctor has asked, do you follow any method? I follow only Hahnemannian method, that is organon of sixth edition. And I am here not to criticize any school of homeopathy. Every school of homeopathy gives beautiful results. It is their perception. But I follow only Hahnemannian method, organon, materia medica, repertory. There is no method actually. There is only one method, that is Hahnemannian method. But I learn all the methods like predictive or sensation or Segal. I learn it, but I never apply. Maybe in some future I may apply, but try to understand what they are also telling you, what the gist they are carrying you. That will give you idea of understanding the remedies. My method is collecting totality of symptoms from the patient, analyzing the totality, matching to the Metromedica. Just simple, single, simple, simillimum. This is my method. So, due to the fears, Carbovich feel lot of anxiety. Horrible vision, seem ghost, a peculiar sluggish, death-like sleep with visions. They feel lot of sluggishness now in the circulation. So why is they sleep? They think I'm going to die. Fear of losing breath, fear of death. That's why Carbovich cannot sleep. Full of anxiety. Wake up with anxiety, covered with lot of cold sweat. Exhaustion, unrefreshed after sleep, and thus put the whole patient in a prostrated by his sleep, so anxious that he doesn't want to go to sleep. Anxiety in dark, anxiety with dyspnea, suffocation, anxiety so great that he cannot lie down. This is the picture of anxiety. Arsenic anxiety is different. Carbovich anxiety is different. Arsenic anxiety is more of health concerned, hypochondriacal. Here, this anxiety is different. The term is anxiety, but you need to, if a patient says, Doctor, I have a lot of anxiety. Okay, mind anxiety. But what in which particular situation you feel anxiety? Why you feel anxiety? Why some doctor has asked how to know this is the main important key symptom of the drug. When you refer lot of metramedicals, you will understand which symptom is main, why they are stressed on that symptom. Try to collect different reading metramedica is most important thing. And in any metramedica, they will give you some bold letters, italics. That could be the key. If you understand the core or the gist or the genius, then you will understand the key. There is no separate book for any confirmatory symptoms, any key symptoms. You need to understand the gist, then you will understand the core. Mind clinging with restlessness is carbovage. See, in carbovage, we cannot see restlessness, but at some stage, we can see the restlessness, that too in the clinging nature. Fear dark alone suffocation. This is the theme of carbons. Ghost, bed in dark, dark as if where he's alone, where he needs someone to hold on. Always they hold on someone. Doctor, my child, even at the age of 20, 23, na, she sleep keeping hand on me, holding on me at night only. And always want to put light and sleep. In dark, she cannot sleep. Giving an indication can be a carbon remedy. Huge claustrophobia, fear of narrow places, fear of accidents, carbovage, carcinosin, graphitis, belladonna. Fear of alone being at night, like stramonium, camphire, helleborus, medorinum. In stramonium, there is a lot of screaming, active reaction, but carbovage is more of passive because sluggishness. They are in a fear, they are in some accident, but they cannot scream because of sluggishness, because of that passive reaction. But due to that, they cannot scream, but we can understand he or she carbovage by examining the cold sweat, pale face, weakness. This is the beauty of carbovage mental state or mind. Mind fear of dark in causticum and carbovage. Fear of death. Mind fear everything constant. I made a one reel on Instagram. If patient explains you lot of fears, the fears more than one or three or four, always think of calcarea carb, lycopodium, pulsatilla. Fear of ghost and spectrums, arsenic, carbovage, pulsatilla, sulfur, opium, phosphorus, sepia, stramonium, valeriana. You know, valeriana is one of the top remedy in hysteria than ignitia. More hysterical remedy is valeriana than ignitia. So I can cover all these remedies, but the time is not sufficient. How we can differentiate, we can understand. This is what we are bringing up in almost all paid sessions or free sessions. Knowledge should be shared, but some knowledge has to be shared on some paid platforms and some free webinars. Mind fear of strangers, beretta carb, carbovage, cuprum and thuja. Fear of suffocation, aconite, camphor, lachesis, lycinum, graphitis, spongia and stramonium. Animals fear, carbovage is their elapse, mancinella, mephitis having icy coldness, sabadilla. This remedy works in almost all winter seasons with lot of watery discharge, coryza, cough, cold. Sabadilla works well, 30C. And sabadilla is mixture of Viathia, arundo, ambrosia. Remember this. Sabadilla is a mixture of Viathia, ambrosia, arundo. Fear of animals, of birds, in that carbovage is there. Mind, sleep, desire to escape from daily troubles. Here you see the polarity state. Carbovage cannot sleep but want to sleep. This is the polarity of each and every remedy. Nux mosquita is the remedy in sleep desna. There is one rubric in synthesis. Back pain, riding, carriage, aggravation. Only single remedy, Nux mosquita. Remember this. Patient tells backache, doctor, while riding on bike only I start lot of backache. Nux mosquita. But one of the top remedy in backaches, if there is no indications and you have given lot of remedies, what is that remedy? You have given beriberi, rustox, or nox mosquita, kalika, but nothing is affecting, nothing is helping. Tell the remedy. Yes, some doctor has suggested. That's good. That is verolinum. If you open Fatak, Metromedica, excruciating back pain, verolinum, do wonders. 30C, water dose. This all the clinical experience which I learned from my guru, which I gained from my guru, which I also experienced, which my guru also experienced in his cases. Pure genuinity source we are sharing here. There will be a lot of dreams of animals, dreams of escaping, dreams of killed, dreams of pursuing, dreams of flying, dreams of many. Mind indifference to joy. Mind indifference, apathy to music, loves which is carbovage and causticum. Even carbovage has this indifferent state. Why carbovage developed this indifferent state? We can see in the next slide. In carbovage, the indifference is very prominent symptom. unable to pursue or feel the impressions that circumstances to arouse. This will affect why the carbovage is indifference is that they are separated or they are dependent. His affections are particularly bloated out so that nothing that told him seems to arouse or disturb him. Heard everything without feeling pleasantly or unpleasantly. This indifference comes very close to sepia without thinking about it. Horrible things do not seem to affect him much. But calcarea carb affects horrible things. Bad stories affect them. Because of calcium component, that insecurity feeling, the carbon fears that you can interlink. So in deeper level, understanding the deeper level of carbovage as a person, they are very timid, childish behavior, bashful, irresolution you can see in the carbovage, the deeper patterns. There is another shade about carbovage where they can be mockers like lachesis, laughing, jesting like lachesis, lavishness and lustfulness like lachesis. See the beauty. How the trade of carbovage is going through each and every pattern. Mind suicidal disposition. Lot of carbon remedies will help in these conditions. Almost all you search any suicidal rubric, there will be carbon element. Mind suicidal disposition, anger, vexation, aggravation. So here you see, I will tell you the beauty of this repertory. This rubric was taken from NER repertory, NER, to understand broad pathological symptom, broad mental symptom. Please concentrate reading NER repertory daily 5 rubrics. This will give you the causation you will find there and the mind symptom you will find there. Beautiful repertory. Carbovage and stramonium. Here you see suicidal disposition with despair of pains. The pathology of pain, broad pathological symptom and a broad mental symptom. Aurum, ars, hyoscyamus, rumex. We always think of in cough cases, but it is also one of the remedy in suicidal dispositions with despair from recovery. Suicidal disposition hanging from arsenic and nitrum sulf. Suicidal disposition shooting by nitrum sulf, staph, anacardium, medorinum, nitric acid, naxomica, and sepia. There is deep sadness from slightest pain, a kind of despair and hopelessness you can see. Mind sadness, pain from the slightest is carbovage. In cancer cases, they have pain. They go into a state of sadness and depression. Think of carbovage instead of aurum met. Aurum met. This is the beauty. Mind sad news after, bad news after, pulsatilla, calcarea pos, carbovage. If it, I'll give you a beautiful question. If a patient comes to you and tells doctor, my patient always, my child now, she desires very tandoori, what I can say, grilled chicken, pizza, burger. But whenever she comes to rice now, she cannot eat. She don't want to eat. All she throw away the rice. What is the remedy? Sure, do it fast. The remedy is calcarea pos. Is my voice is audible? There is no response at all. Is everything going clear? Thank you. So mind anxiety hemorrhages with lungs, lung pathology with lot of anxiety, aconite, carbovage, ipecac, anxiety with perspiration from forehead, anxiety with swelling of the face. This is observation. This is observation. Patient don't tell what you feel in anxiety, but I have anxiety. But if there is swelling of face, can be carbovage. If there is perspiration with forehead, can be phosphorus, aconite, naxomica, sepia, veratrum. Observe, learn repertory, learn metromedica, interlink metromedica with repertory and repertory with metromedica, vice versa. He doesn't quit, know whether he loves his wife or children or not. This is the part of sluggishness. The inability to think, here you can see the confused state. He don't know whether to love his wife or children or not due to sluggish mind, confused mind. Sluggishness in the veins, head feels full, distended, his mind is in confusion and he cannot think. He cannot bring himself to realize whether the thing be so or not, whether he loves his family or not, whether he hates his enemies or not. Very bent and stupid. Everything about the economy is sluggish. Turgid, distended, swollen, hands are puffed, veins are puffed, blood feels full, head feels full, the limbs feel dull. The patient wants to elevate the feet and let the blood run out. The veins are lazy, paralyzed, vasomotor paralysis. The veins of body are enlarged, the extremities have varicose veins. This is the exact pathology of the sluggishness. Mental state with slow indolences, with lot of indifference. Asthma from Kent. We see the patient propped up in chair by opening window. He come directly, sit in the chair like this, falling, and open the window, open the window. Very breathlessness. I am feeling lot of breathlessness, doctor. Please open your clinic window. Ars carbovage, indication of carbovage. The face is cold, nose is pinched, extremities are cold, pale as death. Put the hand in front of the mouth and had the breath with cold. The breath is offensive and putrefied. This is how you can identify the patients in your clinic. Nothing but you need to understand the art of observation. You need to understand the art of learning Metro-Medica. Stomach, there is a lot of erections, heaviness, fullness, tensions from flatulence, temporary relief from belching, you can see. Erections after eating and drinking, nausea in the morning, burning pain in the stomach, extending to back along the spine region, you can see. Crampy pains forcing patient to bending double like colchicum. Distress comes in half an hour after eating. Sensitive of epigastrium region. Digestion is slow due to sluggishness. So that's why they are aversion to milk, fat, meat, fatty things because they cannot digest at all. Sore belching, sore flatulence, you can see the simplest food distresses. Even the minute small food they cannot take due to heavy bolted sensation in the stomach. Dyspepsia, indigestion. It is indicated for bad effects of debauchery, for excess indulge in the table of luxurious, and for bad effects from wines, liquors, and all kinds of deception, like Naxomica. As a result of dyspepsia, we may just such symptoms to call for carbovage, headache, particularly in the morning when the patient awakes from sleep, having spent the best part of the night, dull headache, referred to back part of head with great deal of confusion in the mind. There is humming and buzzing in the head. The patient feels warm, worse in the warm room. The pain also seems to go from occiput to the head and over the eyes, like sang canadensis. Sanguinaria canadensis, right-sided headache in the eyes region, settle in the eyes. There is nausea, usually sort of burning, distress, weakness, referred to the epigastrium. He is unable to take any fatty food, whether the meat, this you understand, meat, gravy, fried food, cannot drink milk because it produces flatulence. Suppose if a patient you are asking, what food you are aversion, doctor? Sorry, patient, I am aversion to fried food, gravy, meat. Okay, written. Then go into repertory, open. But you need to ask why you are aversion to. Why you feel aversion? Why you feel you don't want to eat? Ah, doctor, because lot of flatulence I cannot eat. Carbovage. This is the beauty. You need to interrogate. Never go into the superficial layers of the symptoms. Try to understand the deeper, deeper, deeper. How deep you go, the deep remedy you find, the deep cure you find. Comparison at the mental level. Carbovage very silly, but like lycopodium is lot of seriousness. Carbovage is rarely sexuality. There is a lot of gentleness you can see there. Very rarely delirium, carbovage, excited imagination, rarely apoplexy. But in lycopodium, lot of malicious, greedy, insanity, dejection, want for power, love for power. Lycopodium is almost all of political leaders. In general level, carbovage has excited imagination, nasal complaints, erections on the upper lip, diarrhea generally painful, but calcarea carb diarrhea is painless. This you need to understand. Thirst only during cold stage, but thirsty constant during all stages is calcarea carb with lot of impeccability. That is very sluggish. You can see there due to carbon element. Importance. As I said before, this remedy well indicated in rubrics like never well sings. This remedy indicated person who will never fully recover from the exhausting effect of some previous illness. This line was took from Allen, right? So when you are going to see a patient as a home visit and you see their eyes are half open, there is difficulty in breathing, cold, sinking, moaning, there is a history of cardiac complaints and pulse is slow, you can think of giving CARBO-VEG or digitalis. But what if CARBO-VEG fails? If CARBO-VEG fails, the next prescription is hydrochloric acid, Calicarb, Camphire, Veratrum. You need to differentiate. That are the remedies comes here. Coming to carbo-weight child. Carbo-weight child are definitely sluggish. There is a lot of sluggishness you can see. Lot of stagnation, slow thinking, dull mental, slow in reaction. Parent will come. Um, doctor, my child is very dull mentally, very slow reaction in the school. Teacher always complains of not concentrating on studying. Can't be carbo-weight. Very sluggishness, sluggish circulation, dull, weak, with carbo-weight physical symptom, bluish fingers, bluish toes, extremities are cold. Now, interestingly, if a carbo-weight child put lot of pressure in doing homework, they develop headaches. Because of sluggishness, their mind cannot take up. Then they develop heaviness in the head. Even small hat causes lot of pain in carbo-weight. Single rubric, head pain with hat on. Single rubric, incomplete repertory. They mostly have digestive difficulties, big bellies, got of flatulence. Same you can see in the adult phase at the child phase as well. Flatulence, aversion to milk, wheat, aversion to fat, salty things. The modalities from butter, pork, fat food, from singing and reading aloud with warm damp weather, amal from erectations and begin fanned. Thank you all for attending this session. Each and everyone who has joined, please share your feedback in the group. Our groups will be opening by 2 minutes. I just open the group. So if you have any doubts, you can text here. Please do scan here. In the meanwhile, you can text if you have any doubts. So try to join our paid sessions. We are collecting a lot of information for you all. Each remedy costs you just amount of 20 rupees. So do you have any doubts? You can ask. You can ask. Chat is open. You can ask. Do you have any doubts? Please do text. I'll see the messages right now. Okay, sir, how to give water doses for fast relief? How we can join your paid session, sir? You can scan our WhatsApp groups. Just now I shared the WhatsApp group. Just you can scan there, or you can WhatsApp my number there 81971 That's my WhatsApp. And what water doses I will explain in further courses, or I'll make a video and I'll put in the YouTube how to give water doses. Okay, still anyone have any doubts? And what I want to teach you, still what you want from me? And everyone, please share your feedback. Just pay 1 minute. We are doing lot of hard work preparing this PPT for 1 month, 2 months, collecting matter. You just spare your 1 minute and please share your feedback in your group. And our seats are filling fast. Do join us. Early bird offer is also there. So please do join. And any queries you can WhatsApp there. And everyone, please do share your feedback. Thank you a lot. We'll be coming with another free session on next Sunday. Everyone, please do share your feedback. If you share your feedback, we'll be coming with lot of free sessions. Otherwise, no, because we are putting a lot of hard work for you all just to educate and take homeopathy forward. Thank you so much.